is Dan Yeatts, board-certified OBGYN physician involved in women's health for over 30 years. It may be surprising that the majority of women believe that they can get pregnant on any day of their cycle. However, pregnancy without ovulation is impossible. Let me break down this concept in simple terms. Pregnancy to occur, we need two key components, a mature egg and healthy sperm. The egg is only viable for 12 to 24 hours, while sperm can survive about 5 days in the female reproductive tract. This creates what we call the fertile window, the day of ovulation plus 5 days before it. Many women are frustrated at their lack of success when they seek consultation for fertility. Some of these women don't realize that they are missing the opportunity to conceive by simply paying attention to their body's timing and biology. The math is clear. You have about 6-day window each cycle when conception can occur. Outside of this window, sperm may be available, but the mature egg for ovulation is not available for conception. Then pregnancy simply can't happen. Let's take a closer look at ovulation and how it affects fertility. Ovulation is a precise process that requires a delicate balance of hormones. The follicle-stimulating hormone, FSH, luteinizing hormone, LH, work together to stimulate the growth of a mature ovarian follicle. When the mature egg is released, it enters the fallopian tube where it can be fertilized by sperm. However, ovulation can be disrupted by various factors, including polycystic ovarian syndrome, or PCOS, a hormonal disorder that affects about 1 in 10 women, often creating hormonal conditions that may interfere with ovulation. Thyroid issues. An underactive or overactive thyroid gland can disrupt ovulation and fertility. Stress. High levels of stress can affect hormone balance and ovulation. Extreme exercise that results in significant weight loss can disrupt hormone balance as well. Age. A woman's fertility declines with age. Don't wait to seek help if you're concerned about your ovulation. Consult a healthcare provider if you've been trying to conceive for over a year if you're under 35 years of age. A woman over 35 years of age has the option of further evaluation after 6 months of trying without pregnancy. Also consult a healthcare provider if your periods are irregular or even absent. You experience unusual symptoms like heavy bleeding or pelvic pain. If you have a history of PCOS or thyroid issues. By addressing your fertility concerns early on, you can maximize your chances of conception and achieve a healthy pregnancy. In addition to the steps outlined above, here are some additional tips to consider. Eat a balanced diet. Focus on whole fruits, vegetables, and omega-3 fatty acids. Stay hydrated. Drink plenty of water throughout the day. Exercise regularly. Aim for about 30 minutes of moderate exercise each day. Practice stress-reducing techniques. Try prayer, meditation, deep breathing, or yoga. Get enough sleep. Aim for at least 7 hours of sleep each night. So how can you identify your fertile window and maximize your chances of conception? Here are some tips. Track your basal body temperature chart each morning. Take your temperature using a basal body thermometer. Use ovulation predictors. These kits detect the surge of LH that occurs in the days leading up to ovulation. Monitor your cervical mucus. Look for changes in cervical mucus that indicate ovulation is approaching. Track your menstrual cycle. Keep track of your cycle and can help identify patterns and predict when ovulation is likely to occur. As women age, their ovulation patterns can change. After 35 years of age, the frequency and regularity of the ovulation may decrease, possibly making it challenging to conceive. Furthermore, women with a history of PCOS may experience irregular ovulation due to the hormonal imbalances. One thing I've learned over the years is that these generalizations are not guaranteed. I've delivered many women over the age of 35 who had healthy pregnancies and normal deliveries. Also, I've delivered patients who were previously diagnosed with PCOS, so infertility was not a problem. Let's talk about something that affects 1 in 10 women, PCOS or polycystic ovarian syndrome. When ovulation has been determined to be a problem, PCOS is often the underlying condition. I've cared for numerous women with PCOS. Some of the symptoms include irregular periods, infrequent or even absent menstrual cycles, acne, which is from excessive oil production, unusual hair growth, excessive male type hair growth on the face and body, weight gain. About 80% of PCOS patients have difficulty losing weight. Fertility hormones play a critical role in ovulation. Let's take a closer look at the main players. FSH, or follicle stimulating hormone, stimulates the growth of a mature egg in the ovaries. Luteinizing hormone, also known as LH, triggers the release of a mature egg from the ovarian follicle. Estrogen supports the growth of a mature egg in the ovaries. Progesterone prepares the uterus for a fertilized egg. When it comes to fertility, lifestyle choices can either support or hinder your chances of conception. It's essential to separate fact from fiction and understand the impact of various habits on your reproductive health. A well-balanced diet, rich in whole fruits and vegetables with omega-3 fatty acids, supports overall health, including reproductive health. Avoid sugary and processed foods which can negatively impact fertility. Exercise and fertility. Regular exercise can improve blood flow to the reproductive organs and boost overall health. However, excessive exercise can disrupt hormonal balance and ovulation. Stress and fertility. High levels of stress can affect hormone balance and ovulation. Practice stress-reducing techniques like prayer, meditation, deep breathing, and yoga. Sleep and fertility. Adequate sleep is essential for hormone regulation and ovulation. Aim for at least 7 hours of sleep each night. The key to success is using multiple tracking methods together. When you combine ovulation predictor kit, basal body temperature monitoring, and cervical mucus tracking, you can achieve up to 99% accuracy in identifying your fertile window. I've had a number of patients who simply used a single tracking method, such as basal body temp charting, and ultimately became pregnant. In addition to cycle tracking, there are many ways to support fertility. Eating a balanced diet, exercising regularly, and practicing stress-reducing techniques and getting adequate sleep can all contribute to reproductive health. When you understand your cycle, you're not just getting pregnant, you're taking control of your reproductive health. By working with a healthcare provider and incorporating supportive habits, you can increase your chances of conception and achieve a healthy pregnancy. Many patients often ask about various myths concerning ovulation. Let's clear up some common misconceptions. The myth: you can get pregnant any day of your cycle. The fact is, pregnancy requires the precise timing of ovulation, making a narrow 6-day window for conception. Myth: exercise decreases fertility, when the fact is that regular exercise can improve blood flow and boost fertility. However, excessive exercise can disrupt hormone balance. Myth: food has no impact on fertility. Fact: a well-balanced diet, rich in whole foods, fruits, vegetables, and the omega-3 fatty acids, supports fertility. Here are some simple steps you can take to improve your reproductive health. Start tracking your basal body temperature every morning and record the information in a fertility journal. Use the ovulation calculator from Stork Advisor. Use ovulation predictor kits during your expected fertile window. Consider incorporating fertility-friendly habits into your daily routine, such as a prenatal vitamin or avoiding exposure to unnecessary toxins or substances. I hope this information has been beneficial to you. At Stork Advisor, our goal is to see healthy women and happy families. Please join me again for another topic of interest in women's health care. This is Dr. Stan. See you next time.